Hello everyone, this is Dr. Subhash Chetri and welcome to Child Health Education. As you all know, Child Health Education is a channel in which I impart health education knowledge in common man's language. I also have a website called childhealtheducation.net in which I impart health education knowledge through blog articles in English, Hindi and Nepali. I have started an accident and emergency series. This is the first video of the series. As we all know, children are always running around exploring the world. So they have become prone to injuries, accidents and poisonings. So what to do always in case of all these childhood events? First of all, you must remain calm. It is easy to say but difficult to do, but remaining calm is essential to impart effective first aid treatment to the child. Number 2, explore the scene. Look around and see if there is anything dangerous there or not. For example, in case of vehicle accident, looking for the ignition, whether it is on or not, and if it is on, switching it off is of utmost importance. Number 3, keep yourself safe. It may sound selfish, but keeping yourself safe is one of the most important in first aid. Giving first aid to an injured child or adult itself is challenging, and one more person becomes injured, then it will become burden to the onlookers. Number 4, ask for help. If nobody is around, you can use mobile phone. The emergency number in most of the Indian states is 108 or 111. So what to do in cuts? If it is bleeding, take a clean cloth and apply pressure for 15 to 20 minutes till the bleeding is stopped. It should be a continuous pressure. We should not interrupt in between to check if the bleeding has stopped. Doing this will lead to prolonged bleeding. After that, wash it under clean water. Then apply an antiseptic solution, and after that wrap it with a clean cloth or a bandage. What not to do? As I said, do not interrupt in between to check bleeding has stopped. Number 2, do not apply cow dung, leaves, turmeric, salt or other home remedies which may lead to infection. Number 3, if there is something embedded in the wound, do not attempt to remove it. Many times we have seen in movies and all, they try to remove stabbed knife or gunshot bullet from the wound. This will lead to prolonged bleeding. This should be removed only if the patient has been taken to the hospital and only by a trained doctor. Now, the 4th point, TT. If the child is fully immunized and has received at least 1 dose of TT in the last 10 years, no need for a fresh dose of TT. Contrary to popular belief, TT is not needed every 6 months. TT is needed once in every 10 years. Applying more frequent doses of TT may lead to allergic reactions. When to take the patient to the hospital? If the bleeding does not stop after 15 to 20 minutes of applying pressure, if there is something embedded in the wound like sticks, stones, nails, they should be taken to the hospital so the doctor can remove it. If the injury is in face or nose is bleeding or there is bleeding from the ears, if the wound size is large, if it is deep means if we are able to see tendons, muscles or bones, if pain is severe, if the patient needs a new dose of TT. Now, what to do in case of burns? The burnt part must be washed under cold water, maybe direct turning tap water, and after that wrap it with a clean cloth. Antiseptic may not be needed. What not to do in burns? Do not apply ice. Applying ice will lead to blockage of blood supply. This will impede healing. Also, do not apply home remedies as I said before, like cow dung, leaves, turmeric, etc. Now, when to take to the hospital in case of burns? Like in wound, if the burn site is large, Large burn means larger than the size of the palm of the child's hand. Also, if burn is deep, if burn is in the face, if burn happened in closed environment like closed room. In these cases, smoke may enter through the nose to the lungs. This will lead to severe pneumonitis, or in simple words, pneumonia. If the TT is needed, burn wound can be considered as any other wound, and rules for TT application is same as other wounds. Thank you for watching childhealtheducation.net. I hope you are finding these videos helpful. If you do find it helpful, please like and share, and also subscribe, and also press the bell symbol